President Barack Obama's healthcare reform law goes into effect in about 6 months, but many of the problems plaguing the American healthcare system are likely to persist, and the reasons might surprise you. Quality healthcare isn't just a story about access to insurance. It's also about economic inequality and dysfunctional education.
America has about 50 million uninsured now. After Obamacare is fully implemented, we're still going to have 30 million uninsured. So I don't think you can call it the best healthcare system in the world if you're just going to be excluding 30 million people. In fact, when people look at things like life expectancy and infant mortality, the United States lags way behind other developed countries like Canada or the nations of Western Europe. So the idea that our healthcare system is the best is frankly a myth. It's not borne out by the reality or any of the data.
One of the problems that's going to be coming along with Obamacare is access to physicians, because as you put on another 20 million insured people, you're not going to have enough primary care physicians to take care of these. So what's going to happen is people will sit in a line for their iPhone for a day to get care, but people are not willing to sit and fight for access to primary care. And that's the sad reality, as the number of physicians will not be able to keep pace with the number of newly insured people.
Well, let's talk about different parts of the country. Tina, you work in Kentucky, which is a predominantly rural state. What sort of challenges do you see in Kentucky in your area compared to what someone in, say, an urban center like New York or Washington, D.C. might see?
Well, we have 85% of our state is rural. We are considered one of the nation's poorest states, so we're more affected by the aspects than other states. And as an association, we try to educate. We think the three things that are important are the education, the health, and the poverty. We have to take all that into consideration. We're trying to address the communities that we serve. We've seen that just recently I was attending a rural medical educators conference where we learned that a percentage of medical students and mid-levels are pursuing specialties other than primary care, which means to us that they won't locate in rural areas. And that's a concern of ours because that's primarily what Kentucky is.
So you're having trouble actually getting people who can provide services in parts of the state?
Yes, we have a shortage of providers to care for those individuals. And even though we're going into Medicaid expansion that will cover about 300,000 individuals, we have that shortage of the providers to do that care.
There is going to be an expansion of health insurance. It's true that in some areas there could be some shortage for some people of primary care providers. A big problem is this is a much larger global problem in America. In most of the world, a third of the doctors are specialists, 2/3 of primary care. In the U.S., it's the reverse. Now, some of the things that the Act is trying to do to improve things, a key one is the expansion of funding for community health centers, which really focus on trying to serve low-income people in areas that don't have enough doctors. So that's an important element. Whether we'll have enough funding for the full expansion for community health centers, that remains to be seen, and that's something the states could also help out on by also kicking in some funding to help support community health centers.